Alright, so today I will be doing a bedpan, testing a stool, doing a suppository, and then addressing an ostomy. So first thing first, for the bedpan, I would check my physician's orders with the MAR, make sure we got everything we're needing, and then get all of our supplies. And for our stool sample, we got our cup, tongue compressor, and then the two pads. We're gonna go, we got everything, we'll knock on Joanne's door. Knock, knock. Hello, Joanne.
Hello.
How are you doing today?
Doing good.
Alright, my name's Matt, I'm gonna be your student nurse today. First, can I get your name and date of birth, please?
Joanne Jones, 12367.
Alright, that's awesome. And then can I also get your allergies?
Penicillin.
Awesome, that's great. Not really great that you're allergic to it, but it matches up with my MAR. So I hear you gotta go to the bathroom?
Yes, I do.
Alright, that's great. We'll get you to go right away then. We'll
Okay.
get that going for you. Alright, so Nicole's gonna help me roll you over to the other side. I'm just gonna have to ask you to grab that left room.
Okay.
Alright, good job, Joanne. Alright, I'll get this chuck under you. And that pan, 1, 2, 3. Good work, Joanne.
Thank you.
I'll get your cover back up. Give you something to wipe your hands with and yourself. And then here's that call bell.
Thank
Just
you.
call me when you're done, and then we'll be right back in.
Okay, thank you.
All right.
Ding, ding.
All right, I'm back. So you're done?
Yes,
All right, great. Did you get a chance to wipe and clean your hands off?
I did.
All right, great. I'll just dispose of this into the dirty linens. All right, we'll get that bedpan out from underneath you.
Okay.
All right, now Nicole's gonna roll you over, and I'm gonna grab that bedpan out from under you. Hold it inside you. Yep. 1, 2, 3. Good job, Joanne.
Thank you.
All right, I'll get the chuck on the ground. The stool. Roll off this. Dispose of that into the trash. All right, Joanne. 1, 2, 3. Good job.
Thank you.
All right, we'll give you your call light. And if you do need anything, just please click that. We'll be right in the next room testing your stool.
Okay, thank you.
All right, and then now after that, I would document how much input-output was in there, and also how she reacted to everything that went on. And that's it. And then we'll go test the stool real quick. Give her some privacy. All right, so we got our tongue blade right here, and then our sample cup. And then for the stool, you would test in different areas, getting at least 1 to 3 ounces of fluid or solids, whatever it is. Dispose of this into the trash. You'd write the date, the time it happened, the room number, the name of the patient, her date of birth, and then the doctor, and then I'd sign it and date it, an initial, and then you put it in the biohazard bag and get that shipped off to the lab to be assessed within 15 minutes. And then after that, I would put on new gloves and do proper hand hygiene. All right, and then you can document what you found there, and then obviously what is found at the lab. Next, I will be doing a suppository. So you gotta make sure you get all your supplies there, get the medication, and then also compare it with your MAR and physician's orders and make sure you got the right person, the right medication, and all the right implementation steps for the 7 rights. All right, and then we gotta get our cup. So we get a suppository, put it in there, get a little bit of water-based lube, mix it around. All right, and then you'd want the patient laying on left lateral sims. Insert it with index finger, 1 to 3 inches, and then after that you clean away, down, roll back. So you clean, and then also after you did that, I would change and do proper hand hygiene, change my gloves, and then after that I document the reaction to it, everything that happened within the procedure, and basically that it is done, and then that is everything. Alright, so today I will be addressing stoma and changing the bag. So first thing first, I would do the physician's orders and compare it to the MAR. Make sure we got the right 7 rights and make sure we got doing the right procedure on the right person. Now we're in the patient's room. We'll do the first implementation steps of 2 identifiers, and then assessing pain level 2, and then also letting them know what we're doing, the procedure. So today we'll be changing an ostomy bag, and then first things first, you would unclip the flange, empty it out into a bedpan, then obviously we'll clip that back up, it's empty. Alright, and then next you would take off the bag I'll take off the bag from the faceplate and put it into a bedpan. Alright, and then for taking off the faceplate, you can curl up all the edges and then just pull straight off. Alright, and then next after that, you would clean it, the stoma. You would clean it with 5.5 pH in warm water, and then you'd measure it with a measuring device. Then after you measure it, you'd put gauze on it, and then after I measure, I'd put on new gloves and do proper hand hygiene. Another way of measuring it, you can also use the old faceplate. Alright, so we got it all measured up, all cleaned. We'd dress the stoma by just looking at it, make sure it's a healthy color, and then the skin color around it is also the same color as the rest of the stomach and abdomen. You put on whatever adhesive they would have on before prior putting onto the faceplate. Alright, then we'll apply the faceplate. Right, we got a new bag. Apply that on there, just like Rubbermaid or whatever normal kitchenware you have. Alright, apply it, and then you can also put it on. Some people like it around their side or just straight down, but it's just personal preference. You could ask them that. And then after that, you would dress how they were, see how they're feeling about everything, and then if it's comfortable, and then document everything that you found. And also all the input-output that was out of the bag from the first bag, you document that, and that should be everything.